A great community consists of people with all types of abilities and talents. Vital communities have learned to work together and recognize that everyone has something to contribute. Helena, Montana is a place that strives to include all people, embracing our differences so we may all prosper. For over 40 years, Helena Industries has been part of the Helena community and the greater area. Helena Industries is a nonprofit dedicated to ensuring people with disabilities have opportunities to use their abilities and meet their personal career goals by securing and sustaining meaningful employment. Whether at one of their 7 businesses, at their vocational campus or local thrift store, or with local employers through the Community Placement Program, Helena Industries provides vocational and rehabilitative opportunities to empower people with disabilities. The organization operates under the fundamental belief that everyone has abilities and talents, and sometimes all we need is a place to shine. In this series, produced by Helena Civic Television, you will get to meet the individuals of Helena Industries, learn about who they are, their interests, and how they share their abilities and passions to benefit our community.
I always tell people, just because you have some kind of disability doesn't mean that you aren't capable to doing anything. My name is Josie Christians, and we are at St. Peter's Health in the emergency department. I'm a full-time urgent care tech, and I've been there for 5 months. Plus, I'm a CNA. About a year ago, I actually became a part of this program called Montana Voc Rehab, and I have a counselor there who's pretty much a life support counselor. She helps me with school and everything, and especially getting a job. And so then she knew Ona, who is at Helena Industries, and I was able to connect with her, and Ona was able to connect with the hospital to get me a job here. So when I was younger, actually when I came into this world, I had a tough time coming into the world, obviously. And my mom and dad didn't quite know I was going to make it, but they came around and I'm still here. And when I was younger, I can say that I do have a brain injury because of the lack of oxygen that went through my brain, and as well as my body was filled up with fluid, and I had a lung disease as well. And from that, I struggled with comprehension and being able to remember things. And when I was in the elementary, I was pulled out personally from aides who would help me with my education and my skills with a one-on-one, and I did that all the way through elementary. And so then when I got into high school, I took extra classes that would help me get to where I needed to be, especially like extra math classes, extra reading classes. I took those and I was able to have extra help, and I also struggled with friends because of what I dealt with. I wasn't really that different person, but I kind of felt like I was that different person with the other people surrounded by me, and I didn't think that I would be able to do where I am now, but I've felt like I've came a long ways in life. So when I first started here, I would clean their rooms, and especially when it's super busy in the ER, when people are leaving, coming back and forth, I turn rooms by cleaning the rooms. I'll transport their patients for them to all different floors. And I do their stocking their rooms for them, and I just do as what is needed from the nurses. So I'll be rolling the patient into the ER, and I'll get him onto the bed, and I will get the button to push up to where they are in a sitting position so they're not laying flat. So I now got them down laying on the bed. So then I will now take the blood pressure cuff and the heart monitor and the finger prob. I will get them all hooked up. If I can get all these untangled. And then I'll ask for an arm. And I'll put on the blood pressure cuff. I then will take a finger prod, which reads their oxygen. And I normally like to put the finger prob on the opposite side of the blood pressure cuff. And then I'll turn on the monitor and I'll make sure everything is clear from the other patient. I then will push the blood pressure cuff and it'll record the blood pressure and the oxygen level. And as well as this heart monitor, I'll hook it onto their chest, which will read the heart and make sure everything's going well on there. And then after I get them all hooked up, I normally take a blanket from the heating place and I'll get them all wrapped up in a blanket and ready for their nurses to take care of them. I feel like I've done very great. Like from when I first started here, it was very intimidating to work in the ER. And then as I got routines down and started to figure things out, especially the routes and figuring where everything is, I've done great. I feel really great because I know I have that compassion, especially to take care of people in a hospital environment.